The mpox virus has been evolving over the past few weeks and a new strain has been identified on the continent of Africa. Concerns have been raised due to the proximity of the virus to local shores. The Ministry of Health continues implementing safety measures in accordance with the World Health Organization (WHO) standards to prevent a rapid spread of the virus. St. Lucia's Chief Medical Officer speaks on the current status of mpox.
The emergence and rapid spread of a new strain, Clade 1b, in the Democratic Republic of the Congo, which reports 90% of the cases, and the neighboring countries of Rwanda, Uganda, Kenya, and Burundi, are the most affected by the reported mpox cases. Mpox has also been documented in Thailand and Sweden.
Dr. Belmar George outlines the measures which will be taken by the Ministry of Health regarding mpox. She says discussions with key stakeholders are still ongoing in an effort to be fully prepared for the virus.
The Ministry of Health, Wellness and Elderly Affairs continues to lead the coordination and preparedness plan to facilitate the strengthened surveillance, early detection and management of possible cases. Strengthened surveillance at every level is important to rapidly identify any cases coming into the country from all levels. Sensitization presentations and discussions have commenced with the medical fraternity, the St. Lucia Air and Seaports Authority, tourism sector and education sector.
The Chief Medical Officer outlined the methods which will be used to detect the mpox virus. Dr. Belmar George provides possible solutions for persons who get into contact with the virus.
St. Lucia has the capacity for mpox testing by detection of biviral polymerase chain reaction. There are 2 mpox vaccines that have been approved by the WHO-listed national regulatory authorities. Mass vaccination is not recommended at this time. Vaccination is indicated for close contacts of cases and travelers to the affected areas of Africa.
The Chief Medical Officer encourages citizens to keep abreast with international news on the mpox virus and prepare for the worst-case scenario. Dr. Belmar George outlined the symptoms of the mpox strain.
As we continue to strengthen the mpox response plan, the Ministry advises the public to remain vigilant and adhere to the following guidelines to reduce the risk of infection. Limit contact with individuals showing symptoms of mpox, which includes painful, unusual rash or lesions, fever, headaches, muscle ache, backache, chills, and swollen lymph nodes. These symptoms can last for 2 to 4 weeks. Wash hands frequently with soap and water and use hand sanitizer if soap is unavailable.
Sector-specific protocols will be issued at the soonest so they can take effect immediately. All health institutions will be equipped with the necessary equipment to manage possible mpox cases. The Ministry of Health continues to make preparations for the mpox virus in light of the international health concern. For the DBS News World, Manasseh Stanislaus reporting.